Hi guys, welcome back to Ask the Doc. Sorry for the delay. It's been about 2 months since I last posted, but just caught up with life. And I'm sure you guys all know about it. Things derail your plans and we move forward. But anyway, I got a couple of minutes and I figured I'd make a video to help explain a couple of things, especially for my nurses. And let's dive in. So this case we talk about is called the case of the exploding face. Yes, the face of a patient of mine blew off like a zombie apocalypse and he is dead. Just kidding, just kidding. His face became very swollen. And I figured let's talk about this and use it as a launch pad to learn and educate ourselves if we see this. So let's go through the presentation. Basically, this was a 50-year-old male that came into my hospital and he was riding an electric scooter and somebody cut him off and he flew over the electric scooter handlebars and reported some chest pain. We worked him up. Nothing really horrible was found. The x-rays of his chest were okay. He had a few rib fractures, but nothing horrific. The reason why we did admit him is because he had severe pain and we figured let's watch him for 24 hours, see how he does, and do some pain medication to control this. So we initially did that. We made sure that he wasn't having any acute issues, respiratory wise, if he needed to be placed on breathing treatments or worse, intubated to help him breathe. Everything was pretty good. So good that I actually just placed him as an observation just to watch him over a 24-hour period. So sorry if I'm looking this way because I have a little bit of notes and I don't want to wander off. But so the one thing that we later admitted him and we started him on some pain meds. He was on Percocets and morphine as needed for pain. He's never been on any of these medications and I figured, okay, let's try it. If you have any issues, we'll back it off because his pain was just so severe that good old ibuprofen and Tylenol were not cutting it. So we gave him a dose of Percocets and my nurse calls back and says, hey, his face is getting more swollen. And I said, okay, fine. Is he having any airway issues? No, it's just the cheeks are getting a little bit more swollen. Just the underlying is getting more swollen. And I said, well, maybe because we've been giving him a lot of fluids, it could be possible. But let's rule out the possibility of angioedema. So angioedema is basically a drug reaction or an allergic reaction that causes swelling. And most of the time we see angioedema in the tongue because of medications like lisinopril, which is a blood pressure medication. And the treatment is really stopping the agent. So if you know this drug leads to point B, then stop it. Now, some docs like to also add, say, Benadryl, which reduces anti-inflammatory responses by the immune system. Also steroids, again, which kind of suppresses that reaction. And some docs even do Pepcid. Pepcid is an acid reducer, but it also is a histamine blocker. So in a combination of those three medications, you can also try to reduce the immune system response. Our biggest concern is that angioedema can lead to anaphylaxis, and anaphylaxis is a very serious condition in which this face gets so swollen that you have tracheal, which is your airway that goes down, gets very swollen, and the airway, which is supposed to be open, starts swelling and gets tighter and tighter. And you can see that by your main airway getting tighter, you won't be able to breathe. And most of these people die because of inability to get air in and inability to exchange air out. So my nurse said she was not really concerned about anaphylaxis because his breathing was doing well, he wasn't on oxygen, but she was concerned about the swelling. So I treated it as angioedema. So Now I get a call back from my nurse that the swelling's getting even worse, despite me doing the Benadryl, the Pepsid, and the steroids. So now I'm thinking, maybe this is potentially developing into anaphylaxis, or there's a trauma that we missed on the head. Sometimes if you have a skull fracture, you can get swelling isolated, but she said basically the whole face was swollen. It wasn't like compartmented to a certain section. Then I get another call back that his breathing's getting a little bit more labored, and he has his chest has expanded almost to the point that it was like my bubble jacket. When you feel the guy's chest, it is expanded. It feels like a waterbed. It's fluffy, and the interesting thing is it has this kind of crackly sensation. Immediately I thought the condition, which is called subcutaneous emphysema, and this is when gas or air deposits underneath the skin, raises the skin outward and pillows it. And I'll link it above. When you do a chest x-ray, you see air exiting out of the lung. I'll show you a normal x-ray compared to a patient with subcutaneous emphysema. You'll see the air which is within the lung is now expanding outside, and you can see air on the sides of their armpit. And this patient had air literally moving in and out, and when he took a deep breath, it would come out and then in, out and in. He had swelling all in his arm that when you took a breath, you would see it go like this. It's a very interesting condition. I'll link another video within this one to show you this condition. It's called subcutaneous emphysema.
Hi friends, this is the subcutaneous emphysema. As here you can see the skin of the neck and the chest. Air is being filled there. So as here you can see, when we palpate it, we are having a feeling of crepitations, and when we have pressed it, a pit has developed, and along the sides of the pit, when we are pressing, you can see the air movement below the skin. So this is the classical case of the subcutaneous emphysema, and you can also see the voice change in such a person when the emphysema get there in the larynx, in the voice box. You can have such kind of voice. Thank you.
If you notice this, if you're a nurse or someone in the medical field, or even just a family member looking at your friend, and there's a setting of potential trauma, such as car accident, football injury, and you see the chest getting swollen, you gotta be thinking of tracheal trauma. Basically, the airway of the trachea is damaged, or as you go down, it develops a trachea, then it hits which is called the carina, and then it splits. And you have bronchioles, which are little subsegments of the main airway, and that airway tree could be damaged. And what happens is, as you take a deep breath in, the air goes down into the trachea, and then wherever the leakage is, it deposits the air within the skin rather than in the lungs. And I have a quick little image describing this, basically how the air can get trapped within the tissue. So anytime you're seeing somebody's chest getting really swollen, you confirm it by a CAT scan. You're not going to really see much detail with an x-ray. So sure enough, we did a CT scan, and it showed tracheal trauma. And you know, my hospital doesn't deal with cardiothoracic or emergencies like this. So given this finding, we had to transfer the patient out. He later went into the ICU and was evaluated by cardiothoracic surgery and required repair of the tracheal lesion, or the trauma essentially. And they felt that the trachea got impacted by the handlebars when he went over, causing a tear. So I just want to give you a quick presentation. This happened to me about 2 months ago. Very interesting case. Literally, this guy's face swelled up I call it the exploding face because it's very interesting. I thought it was angioedema, then anaphylaxis, then got another call back by my nurse. Later it was felt to be subcutaneous emphysema, and then found out to be tracheal trauma confirmed by CAT scan. If you enjoy this video and this content, quick highlights of medical information, give me a thumbs up. Once again, sorry guys for the delay. It's been about 2 months. I'm sorry. I've been planning life. It's been hectic. I got an 8-month-old, a 3-year-old. I got family, in-laws, holidays, yada, yada, yada. But hopefully I can keep making content for you guys that's interesting. And have a great holiday. Thank you.